We're here today to say that we will settle for nothing less than a true public option. With a public option, we will have the best tool to introduce competition and choice to an insurance market where most markets border on monopolies.
My name is Beverly Paget, and July 21st, I had no insurance, no employment, no job, and could not afford COBRA, and I did not qualify for social service programs of Medicaid or Family Health Plus. On July 21st, my sugar got so high that I began to burn inside out, and I was hospitalized for 11 days. Well, it should have been preventive care, but a couple of $100 of medication and somebody to oversee my diabetes has turned into thousands of dollars worth of care from specialists and everybody. I almost died. I have 15 grandchildren. Somebody out there still loves me, and I should have had health insurance. I'm getting older, I'm a baby boomer, and things are not going to get any better from here on in. We need options to have health care so that nobody else has to go through this. We do have families, and I am for public options and for everybody to have health care so they will not be in the predicament that I am in now. Thank you.
We're here today joined by distinguished members of this community here in the Capital District. We have representatives here from labor, from the faith community, citizen activists, nonprofit organizations, all coming together here today to say that the public option is the essential ingredient in the healthcare reform debate right now. We cannot let it fall by the wayside. It must be included in healthcare reform, and we have to make sure that it is.
Let me tell you in New York State how it exists right now. The HMOs are a monopoly in each and every area across this state. We did an actuarial study that over a 5-year period, HMO profits increased by over 100%. We have to make it more competitive. Those 2.8 million people in the state of New York without health insurance have to have an option. And that option is the public component of the federal plan.
Thank you. Good morning, everyone. Good morning. Do we want health care reform?
Yes!
Do we want insurance reform?
Yes!
Do we need it now?
Yes!
I think it's a resounding yes. We need to move forward with progressive politics. We need to make certain that we respond to the needs of America's individuals, her families, and her businesses, because all are impacted by the growing costs of insurance premiums and the continued reduction in services that have set a pattern here that deny those who are paying insurance today for many services they require. This is a train wreck waiting to happen. America, this past November, asked for reforms. They asked for a change in how we do business. They asked for respect shown to America's working families. We have the chance to do that today. We need to move forward aggressively to make certain that the information at our fingertips is being utilized to form new legislation that will put those restrictions on those who have had it their way for far too long. People talk about unfairness. What's fair about paying 37% more and getting less? I don't think there's much fair about that. You know, we can't continue this path. We find more and more people falling into the ranks of the uninsured. 14,000 per day. 14,000 people losing their health care. They've lost their jobs. If you change your job, perhaps for the opportunities to expand your skill set, to share your talent in a better, more meaningful way, shouldn't you have the right to carry that insurance coverage with you? Portability is important. People likewise are losing their jobs. Should they be put in the ranks of the uninsured? I don't think so. So there are great reasons to promote the sort of progressive politics that are being encouraged through H.R. 3200. Some 7,300 senior citizens in this 21st congressional district will escape the economic woes of a donut hole that now drains them economically. 1,200 families in this district will avoid the threats of bankruptcy, which is happening today. Some 15,000 businesses will get tax credits made available so they can utilize employer-based health care at their given location. All of this is very important, and some $129 million will go toward our local hospitals that are now being restricted and challenged by the opportunities and the need to address the healthcare outcome for the uninsured. All of this can be made better. All of it can be made resoundingly just and fair if we move forward with the competition that we believe is necessary. Let's support a robust public plan. Let's go forward with progressive policies that will change how we've been addressing a need that has haunted America for far too long. Thank you, everyone.